Hi, my name is Ockert Fourie. I'm the General Manager for MAKROSAFE Central Region. As per our previous video, Leon promised that we would guide you through this ebook. I would like to start off by introducing the Health and Safety Management ebook to you. You may be asking yourself, is this ebook for me? Rest assured, this Health and Safety Management ebook is written for the employer, the employee, the manager, the trustee, and in actual fact, this ebook is for any person designated and responsible for health and safety within an organization. The advice you would receive over the next couple of weeks will help you and your health and safety appointees in managing your health and safety effectively. This ebook explains the plan, do, check, and act approach to health and safety. It also comprehensively explains how it can help you achieve a balance between the systems and behavioral aspects of workplace management. It also treats health and safety management as an integral part of good corporate governance, rather than as a separate entity. Thank you for your time in watching this video. Our next video, presented by Dyllan Steyn, will provide you with information on how to use this health and safety management ebook to your advantage.
Hi, my name is Dyllan Steyn. I am a health and safety consultant at MAKROSAFE. As Ockert mentioned in the introduction video, I have the privilege to explain how to use this health and safety management ebook to your advantage. This book will help you to put the right measures in place to manage the real health and safety risks of your company. Part 1 of this ebook gives you the core elements of the health and safety management and how they can be integrated into the way you run the rest of your business. Part 2 shows you what to look out for when planning, implementing and managing health and safety. Part 3 of this ebook will give you advice on delivering effective health and safety plans and procedures. And Part 4 is a list of useful resources on health and safety, which include details. Rest assured that we at MAKROSAFE have a health and safety package tailored to just for you and your company to assist you with implementing, managing and also the resources for health and safety. Now the fun part starts. In the next video, Jessica Cholwich will explain the plan, do, check and act approach to health and safety.
Hi, my name is Jessica. I'm a health and safety project specialist with MAKROSAFE. Now that Dyllan explained the advantages of a health and safety management ebook, I will be explaining the safe approach to health and safety should you adopt the plan, do, check and act approach. The plan, do, check and act approach achieves a balance between health and safety system and the behavioral aspects of health and safety management. It also treats health and safety management as an integral part of your overall business management, rather than as a separate entity. Let me briefly explain to you on how the plan, do, check and act approach falls in line with effective health and safety management. Plan, determine your policy and plan for its implementation. Do, profile risks on compliance and your tasks, activities. Organize them for health and safety and then implement your plan. Check, measure performance, monitor before events and investigate after the events. Act, review your performance. Act on investigations and lessons learnt. It is important to remember that continuous improvement plays a major role in the whole business process, and for this reason, we will on a continuous basis visit any one or all of the elements on an ongoing basis. Thank you for taking time to watch this video. I trust that I have shed some light on the plan, do, check and act approach for you. In your next video, BCF Molefe will elaborate on the plan of the plan, do, check and act approach.
Hi, my name is Fourie Molefe. My friends call me BCF. I have been in the health and safety industry since 1973, and I must say I'm very excited to share my knowledge with you in this video. Now that you understand the process around the plan, do, check and act cycle, I would like to spend some time on the planning process. Proper planning involves assessing the level of health and safety that you are currently in and looking at what you want to achieve. In short, what is your goal? When you have a clear understanding of what your goal is, jot down the specifics that you want to achieve and allocate specific responsibilities to specific individuals. Once you've done this, draft how you're planning to achieve your health and safety goals. Also, plan immediately how you're going to rate the effectiveness of your plan and how you will measure your success. Then, decide how you will measure performance. It is extremely important to brainstorm various ways of how performance can be effectively measured, which goes beyond merely looking at your incident figures. You can look for leading indicators as well as lagging indicators. These are also called active and reactive indicators. Just as it is important when you do your planning, consider the essential aspect of emergencies such as fire, injuries, explosions, and any other emergencies. If you share your workshop with other organizations or companies, it is wise to work cooperatively with them to coordinate any plans as they may have an effect on your health and safety. When planning, consider changes that may occur in your workplace well in advance. And remember, there may be changes in legislation and practice as well. You must be able to identify any specific legal requirements that apply to you at all times. That is, in short, your planning phase. In your next video, Nesh Mata Badul has the honor of explaining the DO approach to health and safety. Remember, the health and safety of your employees, contractors, and visitors must always be your #1 priority.
Hi, my name is Nash Mathabado. I am a Health and Safety Administrator at MAKROSAFE Central. In the previous video, BCF explained the plan process to you. Now, I would like to take a minute of your time to explain the DO process, and this is where your health and safety program becomes interesting. In the DO of the process, it is essential that you identify your risk profile. This means identifying all possible risks that may be present in your workplace or may be associated with your working activities. Assessing the risks identified is the follow-up step. When doing so, identify what could pose health and safety risk or harm in the workplace. Further, identify who is at possible risk and implement control measures to manage the risks that have been identified. When identifying risks, make priorities based on the biggest and possibly most fatal risks and deal with them first. Organize your activities to deliver your plan. In particular, aim to involve the employees in your activities. Communication is key to the success of any health and safety activity. Communicate with employees to ensure that everyone clearly understands what is expected of them in their activities. Communication allows for the initiation of discussions which clarifies any queries or misunderstandings and ultimately develops positive attitudes and behaviors of employees. Provide adequate resources to employees, and if needs be, competent or professional health and safety advice is recommended. Once these stages have been followed, you can now implement your plan. Decide on the preventive and protective control measures needed and implement them. Ensure correct, certified, and well-maintained equipment, machinery, and tools are provided for any jobs employees are expected to do. Comply with the stipulations of the Occupational Health and Safety Act and Regulations 85 of 1993, and ensure all employees who are stipulated by law to undergo training are well trained and certified. This ensures that they are competent to carry out the specific work they were trained to perform. Very important to remember, and this is out of my own personal experience, the only way to help reduce cases of incidents and fatalities, working activities should be done under supervision of a well-trained and skilled supervisor, whose duty is to ensure all activities follow the right procedures and channels planned. I trust I shed some light on the do process of plan, do, check, and act approach. In your next video, James Dlamini will be explaining the check approach of health and safety.
Hi, my name is James Dlamini, and I'm a health and safety inspector and facilitator with MAKROSAFE Central. BCF and Nash explained the plan and do approach of the health and safety. Now I will explain the check approach to health and safety. Once your action plan has been executed, it is time that you check and measure your health and safety performance. You may ask yourself how I will be doing this. let me give you a few tips that I have learned over the years. Ensure that your plans have been implemented correctly. Important to remember that paperwork alone is not enough to measure your health and safety program's performance. Practical measurements should also be considered too. This can involve assessing how well information and training was understood by employees through toolbox talks. Assessment of the effectiveness of the health and safety control measures should be done, and it must be determined if the goals are set being achieved. From my own experience, a formal MAKROSAFE audit can come in handy in assessing these control measures. Remember, all accidents, incidents, and near misses must be taken into serious consideration. For all of them, investigations must be launched and the causes of the incidents must be established. Thank you for your time. I am honored that I had the opportunity to share some of my knowledge with you. In your next video, Ruan will be explaining the ACT approach to you.
Right, BCF explained the plan approach to health and safety management. Nash told you how important the do approach is, and James discussed the check approach to health and safety management. Before I discuss the most important part of health and safety management, namely the ACT approach, I would like to introduce myself. My name is Ruan and I'm a consultant at the MAKROSAFE Central Office based in Alberton, Gauteng. I am sure you would agree with me that no health and safety program will be effective if you don't act on your observations from inspections, audits, control measures from your risk assessment and or your incident, accident or near-miss occurrences. As you know, should you have any findings on any of these, it is time to review your health and safety performance. This means your health and safety plan must be revisited, improved and restructured to suit the situation at hand. This might even require an update or review of your health and safety policies, safe operation procedures, emergency preparedness procedures and or your risk assessment control measures and much more. I trust you enjoyed this brief introduction to the ACT approach to the health and safety management. This brings us to the end of the eBook's introduction. In our next video, Ockert will talk to you about the core elements of health and safety management in the workplace, which is part 1 of the eBook.